Hello, good afternoon, everyone. Great to see you today. Welcome to today's IECHI Quarterly Health Education Forum, Medi-Cal Redetermination, ensuring families continue to receive benefits and stay healthy. I'm Allison Elsner, and I'm the CEO of the San Bernardino County Medical Society. I'm also the chair of the IECHI, or the Inland Empire Community Health Initiative, a coalition whose mission it is to ensure that all families and residents have access to affordable, quality, and culturally sensitive health care in the Inland Empire. And that, of course, includes Riverside County and San Bernardino County. You can always find out more on our website at iechi.org. And please like and follow our Facebook and Instagram pages for some great event and project updates. Just a couple of quick notes. If you would be so kind as to keep yourself on mute when you're not speaking. And please feel free to ask questions, which we'll present to the speakers after they've concluded. And you can do that by raising your hand with the raise hand feature, or go ahead and enter those into the chat, and we'll take those then when we start fielding the questions. So with that, we're going to jump right in. I'd like to begin by introducing our opening presenter. Warren Snider has been a staff attorney with Inland County's Legal Services since 2017. He received his law degree from UCLA School of Law in 2009 and has 13 years of experience working in public interest law. Since 2019, he has worked on Inland County's health law team, assisting low-income, elderly, and marginalized clients to obtain insurance coverage, access to medical services, and resolve medical debt. Warren, we're very happy to have you join us. Take it away.
Thank you. Let me get my screen shared real quick. Thank you. My name is Warren Snider. I'm a staff attorney with Inland County's Legal Services. We're a nonprofit legal aid for Riverside and San Bernardino counties, providing free legal services to seniors and low-income residents of those counties. And we're also part of the Health Consumer Alliance, which is a statewide network of legal aids that assist with healthcare issues. So I'm going to jump right in to kind of an overview of the Medi-Cal renewal process, how it's been going, and yeah. So back COVID-19, there was a public health emergency declared back in March of 2020, and all Medi-Cal renewals were put on hold. So except for a small, very limited number of exceptions, if you were on Medi-Cal at the start of March 2020, you stayed on Medi-Cal all the way up until the health emergency ended on April 1st of this year, and they started doing redeterminations. And it's about a 3-month process. So we've started seeing the first discontinuances as of July 1st of 2020. One important thing is that in general, you'll keep your regular renewal month. So if you always, before COVID, got renewed in February, you won't have to renew again until next February. You're good. The one major exception is that if your Medi-Cal is like linked to, like, if you're getting CalWorks, if you're getting CalFresh, or something like that, and they do a renewal before then, they can throw your Medi-Cal in with there. And so this is kind of how the renewal process works. There's basically 6 steps that the counties have to take by law. The first is they attempt to renew you on their own. They pull from a variety of databases they have access to, and if they have all the information they need, then you'll just get a notice in the mail saying you've been approved for another year of Medi-Cal. You're good to go. If they can't get all the information they need, then they're going to mail you a renewal packet that needs to be returned within 60 days. About a month later, they'll send you a reminder, and then a few weeks after that, they'll send you a second reminder. And then if they just don't get anything from you or don't get enough from you, they're going to send you a termination notice. And the termination notice by law has to be sent at least 10 days before your Medi-Cal would be discontinued. So they can't send you a notice on September 30th saying you're going to be cut off on October 1st. And then your Medi-Cal gets terminated. And so just as an example of what that would look like, if your renewal month is October, the county may try to do an auto renewal around October 7th. They'll mail out a packet to you on October 19th. About a month later, on November 19th, they'll send you their first renewal reminder saying, hey, you still need to get your packet in. And then about 2 weeks later, on December 2nd, they'll send a second reminder saying, hey, still haven't got that information from you. And then on December 20th, you're going to get your termination notice, and your Medi-Cal is going to be cut off as of January 1st. You have a number of rights and flexibilities that have been added to the renewal process just to make things easier for everyone. As you may or may not be aware, the asset limit for seniors has been changed. It used to be very low, like 2,000 in assets for an individual and 3,000 for a couple. A couple years ago, that got moved up to 130,000. Starting January 1st of next year, that asset cap for Medi-Cal for senior and disabled individuals is being removed entirely. But for now, they've already said if you're renewing your Medi-Cal, the county's not going to look at your assets at all. The forms still ask for them, but you don't need to provide that information. And there's supposed to be a notice going out kind of statewide next month, letting you know that you don't need to provide that information. If you're newly applying for Medi-Cal, until next January, you still need to provide your asset information, though. This is just for renewals that don't need to. There's also a more flexible ex parte for people who are below 100% federal poverty level. And the way that works is if you're way down there, the last verified information the county has you below 100% of the federal poverty level. And they look at and you haven't told them that you had an income change, you haven't given them any reason to think you would have an income change. They look at their databases, they don't see anything that would suggest that you've had an income change. They can go ahead and just approve you. So it's a little bit easier to approve people who are in the very lowest income brackets. They've also, until next May, they've suspended the requirements to apply for benefits and cooperate with local child support. Previously, if you'd applied for Medi-Cal or been renewing your Medi-Cal, you might have been asked, hey, why haven't you applied for unemployment? Why haven't you, applied for SSI, things like that. Hey, we see, you're a single parent. Why haven't you opened a child support case with the county? Why aren't you getting the other parent to cover health coverage? What's going on there? All of that, you don't need to do it until next May. That's all been put on hold just to help people renew a little bit easier. There's also a renewal flexibility for hard to reach populations. This one's very, very broad. And it basically says that if there's any kind of barrier that might make it difficult for the county to get in contact with you when your renewal month comes up. And so that can be, not just you're homeless or not just you have a fixed address, but you're aged, blind, or disabled. There's been a natural disaster. You live in a remote area. You're incarcerated, you're a migrant worker, you're in foster care, or really any community that the county thinks is appropriate. And you go in and they get your income information from you. Let's say you go in and you apply for food stamps or something. Your renewal month's next January, but you go in today and you apply for food stamps. And now the county's like, okay, we've got this person's income information. We know they qualify for Medi-Cal. They can bump your renewal up and just do it right now. They can't ever do anything negative on that. They can't say, oh, we're going to kick you off early. But if they get all the information they need from you and they think they might have a hard time reaching you when your renewal month rolls around next January, they have the option to go ahead and just approve you now, and then you'll be good for another year. And then the 90-day cure period. So this will be on your notice. If you get a termination notice, it's on there, but just to kind of explain, if you don't provide the county all the information they need to renew you within your 60 days, but you get it to them within 90 days of your termination. So let's say my renewal was a couple months ago. Now I'm being terminated October 1st because I didn't turn in my packet. I have 90 days from October 1st to give the county, my packet or my pay stubs or whatever they didn't need. And if they look and they say, okay, now we have everything we need, it looks like you're still Medi-Cal eligible, they'll renew me and it'll retroactively renew me so that it's like I was never discontinued. And that's good for 90 days. So that's the 90-day cure period, and that's going to come up a little more later. There's the right to self-attest to things. If the county says, hey, we see that you're working for the YMCA, where are your pay stubs? And you say, I haven't worked there in like 4 months. I went to them, I asked them, hey, can you give me a letter saying when I last worked for you, what my pay was? And they say they don't respond, they're too busy, whatever, right? You can explain the steps you went through to try and get the information the county requested, and you sign it and you submit it. There's some rules about that, but just in general, if you try hard to get something the county's asking for and you can attest to what it is. And if the county doesn't have information that contradicts your attestation, that they'll accept it. And so you can't get those old pay stubs, you can't get that proof of when you were laid off, whatever, you can attest. And that kind of rolls into the reasonable explanation. If the county, so when you submit your packet, you say, here's what I'm making, here's what my property is, and the county, does their database thing, and they might say, hey, we see that you're working at this other place, what's going on there? Or hey, we see that you own an extra car, what's going on there? You can explain what's going on, and as long as it's like a reasonable explanation that isn't contradicted by the data on hand, they have to accept your explanation, basically. Like, oh no, again, like I haven't worked there in 3 months. No, I sold that car. Here's my proof that I sold it, whatever. We talked about the notice of action at least 10 days before termination. That will come up again in a little bit. And then these aren't really like rights, but they're just some kind of safeguards, I would say. If you actually just don't qualify for Medi-Cal, if you lose your Medi-Cal, what happens? If you're eligible for covered California, which means you're not on Medicare, you're not getting insurance somewhere else, then you get automatically transferred to covered California. And what they're going to do is they're going to try to place you in the same plan as you had through Medi-Cal. So like if you're on Molina, they'll put you on a Molina plan, a silver plan in covered California. If there's not a covered California plan for your Medi-Cal plan, like IECHI, then they put you on the lowest cost silver plan. So they try and find the cheapest plan for you in the silver bracket. You have 30 days that you have to confirm that by logging into covered California and by paying your first month's payment if you have one. You also can choose a different plan if you'd rather be in a different plan. And you can opt out entirely. If you say, I don't want to be on covered California, I'm going to get insurance elsewhere, you can do that as well. You have 30 days to do that. And then if you don't, then you don't get enrolled, but you still have a full 60 days. So an extra 30 days, what's called a special enrollment period. Normally with covered California, you can only enroll between October and January, depending on the year. There are life events where you get 60 days to enroll. One of those is you lose your health coverage. So you get kicked off Medi-Cal. They'll try to transfer you into covered California. If you don't do anything those first 30 days, you still have the full 60 and extra 30. If you want to go back to covered California, say, oh, my bad, I actually do want to be on covered California and enroll. So that's pretty helpful. And then if you're on Medicare, if you qualify for Medi-Cal, you should automatically be getting the Part D extra help or the low income subsidy, what people call, and it puts you on a prescription drug plan and pays a bunch of your prescription drug copays. Even though that's automatic if you're on Medi-Cal, they're not technically linked. And that's important to know. So if you get kicked off of Medi-Cal before July in a year, you'll keep your extra help all the way to the end of that year. If you get kicked off after July, you'll keep it to the following year. So if you get removed from Medi-Cal today, but you have extra help, you'll keep that Part D extra help all the way through December of 2024. And then the last thing to know there is that the requirements are a little less strict than Medi-Cal's. So you may qualify for extra help through a different program, even if you don't automatically qualify through Medi-Cal. And Social Security should send you a letter letting you know you have to reapply, usually around September. And you can reapply through there, and you might still qualify even if you don't have Medi-Cal anymore. Okay, so then how has California been doing as far as the renewal goes? So DHS says that before the pandemic, about 18 to 20% of people were getting disenrolled after their 90-day cure period had finished. So after they kicked everyone off, and then people, had a chance to turn stuff in those extra 90 days or file appeals in those 90 days, we're at about 18 to 20% every month being disenrolled. And then our current data is only through July, and it's pretty incomplete. But we're at 24% right now. DHCS is hoping that comes down quite a bit. They were estimating maybe like 4%, maybe a little more. Once we get to October and that 90-day period for those initial disenrollees is passed, and people have tried to, appeal or whatever, we'll have better numbers next month. We should also be getting new numbers in a few days. The last numbers are from August 18th. But yeah, so far, 24% of people who were up for renewal got disenrolled. That's 302,000 people. 85% of those were for procedural reasons, which is a pretty big deal. That means they didn't turn in their packet. Only 15% turned in their packets and were told, you don't qualify for Medi-Cal anymore. You make too much, or you have this other insurance or whatever. Yeah, so it's just super important just to make sure you're getting those packets in so the county can actually process you. The numbers are also kind of wonky because about half of the renewals, 538,000, haven't been completed yet. So those are still pending for June and July, and then in April, May. And then there were 160,000 people who were supposed to be disenrolled on August 1st, but the state didn't send them their 10-day notices. So they were all pushed out to September 1st, and they were sent 10-day notices last month. So that data is still in there as well as part of that 538,000 people who hadn't finished their renewals yet. So again, next month, supposed to get a lot more information, and we'll kind of have a better idea of how things are going. Overall, good and bad. It's not that much higher than pre-COVID, but I think, functionally when 85% of people are getting kicked off just for not turning in their packets, that's not great. And then we're doing 8th best in the nation for what that's worth. So, could be a lot worse. And then the ex parte renewal rate is at 27%, and the state's really working on trying to find ways to get that number up, and hopefully we'll see that a bit higher in coming data as well. I think that's about everything I have. And then, the Health Consumer Alliance, which I mentioned earlier, we do have a resource page at healthconsumer.org/COVID-19 that has a lot of information on just what you need to do to stay on Medi-Cal, and some options available to you. And so that's all I have. Thank you very much, and I'll turn it back over to you guys.
Fantastic. Thank you so much, Warren. That was just great. We have received a couple of questions. Will you be able to share your slides after this? Can we send those out to the audience?
Absolutely.
Wonderful. We really appreciate that. Okay, so after this presentation, we'll be sending out Warren's slides as well as a recording of this. So, all right, thank you. That was really, really great information for us. Now we know what the process is. Thank you. So I'm really honored to be able to introduce our 3 panelists today, and I'm going to go ahead and introduce them in alphabetical order. First off, we are very excited to welcome our dear friend Ruthy Argumedo, Associate Vice President for Growth and Community Engagement with Molina Healthcare of California. Ms. Argumedo has been with Molina Healthcare for 16 years, leading their growth and community engagement efforts. Her work is focused on one of her true passions, serving the community. As part of her work, she has led various community programs, such as the creation of the Care for Health IE event series, one of the largest comprehensive healthcare events in the Inland Empire, which served over 20,000 individuals for over 6 years, providing free healthcare services and multiple services to thousands of IE residents. When COVID struck, Ruthy and her team led the efforts on PPE donations, COVID clinics, and provided much needed items to community partners and the community itself. Throughout the years, as needs have been identified, Ruthy has worked on creating support for those needs by hosting diaper and hygiene drives, food giveaways, and back-to-school supplies. She is now leading Molina's efforts in launching a health drop trailer and 2 RVs to provide healthcare and resources in the community, along with 5 one-stop help centers, which will provide free resources to the community. Today, Ruthy is responsible for covering the Inland Empire, San Diego, Los Angeles, Sacramento, and Imperial counties. Thanks, Ruthy, for being here today. Next, I'd like to introduce Andrea Joubert, MLSM, Master Education. Ms. Joubert is the Manager of Eligibility Continuity Strategy for Inland Empire Health Plan, or IEHP. For over 18 years, Andrea has worked for the County of Riverside and the Department of Public Social Services administrating the CalFresh and Medi-Cal programs. In her role there, she supervised the Community Outreach Branch, where her goal was to enhance the public awareness and perception of DPSS programs, strengthen and maintain community partnerships, assist the community and community-based organizations as well in understanding how to apply and retain Medi-Cal and CalFresh benefits. Since June 2022, Andrea has worked for IEHP, where she manages a team of 50 members who are focused on member retention. And thank you so much, Andrea. And we do want to note that on your invitation, you saw that Shaylon Jones would be joining us, and she unfortunately is ill today. So Andrea very kindly is stepping in her place, and we're honored that you were able to do so. Thank you. And we would like to introduce Rhonda Wolke, Regional Manager for the Transitional Assistance Department Administration for San Bernardino County. Ms. Wolke started working for San Bernardino County in 1996 as an eligibility worker. She was promoted to positions including supervision and management. In her role with the Transitional Assistance Department for the county, she is responsible for providing support in the administration programs to assist community members we serve, especially those in need of financial, nutritional, and medical assistance. Welcome, Rhonda. We're thrilled to have you with us, and we appreciate it. So I'm going to jump in and start asking our guided questions. And we're going to start with one panelist at a time. And once we finish that, if another panelist would like to answer, please feel free to jump in, and then we'll rotate those questions. So Rhonda, let's start with you, if that's all right. First question is, please explain your agency's process for redetermination, including notification, application timelines, data exchange system on enrollment status, and the like.
Okay, so thank you. Good afternoon. It's my pleasure to join everybody here today. So Warren did a great job of sharing a great overview of Medi-Cal and the processes. So in regards to the applications, normally applications are processed within the 45 days of the application date. And this includes when verifications are required. And these are items that are not e-verified through the federal hub. The applicant will have 10 days to provide the requested verifications and information. And along those lines, as far as completing the application, it can be completed by the applicant or an authorized representative. And then, give me one moment. So for redeterminations, I wanted to just share, as he shared, they're also due annually, usually every 12 months. CalSAWS will be our first attempt to process the RE for MAGIC cases through the automated RE process, and up to 90 days prior to the RE. Cases that are, as he shared, that are not successful with the process, as well as all non-Magi cases, will have a physical RE packet that's mailed to them, to the address they last had on file. And they've actually go out 60 days prior to the RE due date. The cases are reviewed and the RE is processed. So the ex parte review is completed, and the use of the information and verification from sources already available. Like I said, we try to use as much information that we already have available before we're reaching out to the customer to gather more information. So that could be a variety of systems, looking in CalHERS, EDD, if we have any other case file information, to be sure that we're doing some cross-reference. And as far as for eligibility determinations, if determined eligible, a notice is sent to the applicant, redetermination, letting them know that's been processed. If they're deemed ineligible, we are required, as shared, to provide them a notice that's sent to the customers to let them know that they're not eligible, but they have 90 days to restore benefits. So, there's not a lot of change into what was already shared. That's our normal standard process that we also use as well in regards to taking applications and processing renewals. So, I'd be glad to answer any questions, or if anybody has anything to add in regards to that.
Why don't we, thank you so much, Rhonda. Ruthy or Andrea, do you have anything else you'd like to talk about with regard to your process, especially that might differ from Rhonda's?
Hi, well, welcome everybody. Great to have everybody here. So I don't know that so much that it differs. On the contrary, I think it really supports what the county and what the counties are sending the individuals. So what we try to do is really understand what communication that they receive and walk them through it, explain it to them. Sometimes it's just confusing, or they don't understand, or they need it translated. So it's really just supporting the communication that went out by the county, making sure that the members understand the language, that they understand the dates on those notifications, and they comply and provide the resources or the requests that are being asked from them.
Yes, and I would also like to echo Rhonda and Ruthy. IEHP, we follow, of course, the same processes that the county does as far as redetermination. One of the things that we are doing that is a little bit more unique than in past times is that IEHP, we are sending out flyers to our members during the renewal month. So if you have a renewal that is due in October, for example, IEHP will send you a flyer that says, please renew your Medi-Cal, and you can call us and we will provide one-on-one support to you. So what does that support look like? I manage a team of 50 team members who have Medi-Cal experience. They came from Riverside, San Bernardino, LA counties as Medi-Cal workers, CalFresh workers, and they will guide the member through step-by-step process. So we will help them create a benefitscal.com account, and we'll navigate through that application of completing the renewal. Or if that member says, you know what, Andrea, I'm not tech savvy, I have the paperwork right here, can you walk me through the paperwork? And we will go page by page and walk that member through the paperwork. We also have our community resource centers that are located in Victorville, Riverside, and San Bernardino, and we are on site every Wednesday at each site for that in-person support. So as you know, sometimes our senior population, they don't want to do anything over the phone, right? Because we've been really good at saying, don't answer that phone, don't share your personal information, right? So they can come to our community resource centers where we will provide that one-on-one support. Another thing that we are doing that is more unique than in past times is that we are sending out intentional text messages. So we send out text messages to our members who reside in Riverside and San Bernardino counties, letting them know that they have an upcoming renewal due. And if they would like support, when they receive the text message, they can click, yes, I would like immediate support, and it will take them to our 800 number where they can give us a call. Or if they say, I want help, but today's not a good day, can you call me back on Friday? And so we will take that information and give them a call back on Friday. So not only does our team provide one-on-one support over the phone, through Benefits Cal, and in person for renewal, we will also update a member's demographic information. So if they've moved over the last 3 years, maybe they didn't get that renewal packet, or they thought that they updated their information with Riverside and San Bernardino counties. We do have a partnership with DPSS where we do share our data. So if a member reports that they have updated their address, we will share that information with San Bernardino and Riverside counties, so that when their renewal time does come, they can the counties will ensure that they are sending that information to the correct address. I see a question in the chat. Do we have a fair number of folks who show up to the in-persons at the community resource centers? Actually, we do. Yesterday, we also do renewal presentations in English and in Spanish. So if members want to come in and just ask questions about how to do a renewal, what do I need to provide, pay stubs, proof of expenses, childcare, things like that, you can come in to our workshops. They're twice a month because we have one in English and one in Spanish at each site. Yesterday at our San Bernardino site, we had 5 members that came in, so we're really excited about that. There were days when we had 0 members come, but really excited that we had 5 members come to our Spanish presentation and wanting to know to get help and support with that Medi-Cal renewal.
Wow, that's really great. Thank you. And thank you as well, Ruthy and Rhonda. Great information. All right. Well, then let's move to and we're getting questions, but we're going to just answer those at the end, if that's okay. But it's fine if you want to jump in. If somebody sees one you want to answer, go for it. We're flexible. All right. Ruthy, how about if we give this one to you? What systems are in place to assist and support the more vulnerable populations that you work with? Seniors, persons of color, non-English speakers, which Andrea was just talking about. For instance, community health workers or other. Do you have some protocols you'd like to share with us on that?
Yes, absolutely. So one of the things that Molina has done is we noticed that, there's only a certain portion of individuals that come in through our member services or that come in through our renewal line that are looking to get information. So what we have done is we've taken all of our internal departments and we've created talking points, very specific things that they can do to assist members. So for instance, all of our case managers that are working with the disability community, or all of the case managers who are working with our most vulnerable, the senior community. It's really working with each one of them to make sure that they're providing the information, they're providing the reminders, that they're explaining to them what are some of the things that they should be on the lookout. We also have done in our system, when someone calls today to Molina, regardless of the toll-free number that they reach out to, we have on-hold messaging that provides them with guidance and next steps and some of the key things that they should be on the lookout, reminding about redetermination. We're also very similar to IHP, doing presentations out in the community. We are doing it with our community-based organizations, our family resource centers, through one of our one-stop help centers in Indio. We have partnered with Riverside County to have their mobile team come out, provide information, provide focus group resources, any kind of presentation that they can do to ensure that folks are getting the message. We know that not everybody gets and understands the information the same. So our approach has had to be very specific based on who's providing that information. So whether it's a case manager, whether it's a Molina field worker going out to community partnerships, or whether it's church and faith-based organizations, the idea is to really get that message, make it and modify it so that it fits the audience that we are presenting in front of. So when we look at today, the work that we're doing, it's really getting the message out through emails, through text, on-hold messaging, our case managers, and then looking at the audience and making sure that that message is modified through whichever means we are communicating, whether it's a case manager, a medical director. Everybody at Molina is invested to make sure that we are communicating on multiple levels. So that is what we're doing today, and really looking to see feedback from our members to understand did you not get? Is the message not getting to you? What part don't you understand? And working to simplify that message and continue to improve those communication efforts on our end.
Wow, that's impressive. Really covering all the bases. That's true on multiple layers. That's great. Rhonda or Andrea, did you have anything else? Or Warren, please feel free to jump in as well. You can absolutely be part of this panel with all of your knowledge as well. But Rhonda, did you have anything you'd like to add?
Yes, I sure do. I wanted to share that we have a grant to support our partnership. We actually partner with Loma Linda University Institute. And what they do is they help support enrollment and retention. And some of their targeted audience, or populations, I should say, is our age persons, 65 and older, persons who are homeless, immigrants or families with mixed immigration status, people of color. So, we have a great partnership with them. Besides, working with IEHP as well as Molina. So that's been really helpful to have their additional support. I believe even one of our partners is on the call today as well. So I was glad to see that. And then also we offer a variety of ways for customers to apply and complete their RE. So, they can do it online, as we know, through Benefits Cal or Covered California website, in person at any of our offices. And we have outstation offices, including self-service options, or through our certified enrollment counselors. And then also by calling our customer service center. So, we try to offer a wide variety of support as well. But I wanted to mention, like I said, our partnership with Loma Linda has been also another great avenue. And they work very hard doing outreach and holding different events and, doing the same thing, guiding them customers through the process, and thankful for their support as well.
That's great.
So
Andrea?
so for the vulnerable populations that you mentioned here at IEHP, we do have, for my team members, we do make outbound calls to our members. And so on my team of 50, I have 26 team members who are Spanish speaking only, and I have 4 team members who speak the languages of Cantonese, Vietnamese, and Mandarin, and then English, of course, because we want to make sure that those people who do speak, in particular, those 4 threshold languages, feel comfortable knowing that there is somebody here on the other line that can assist them. We do know that, of course, that at the county, they do have interpreters, and the workers can assist them at the county level based on their language, but we don't ever want any member to feel like they can't receive that support just because somebody doesn't speak their language. IEHP is also very intentional about supporting our community. So you will see us at various community events across Riverside and San Bernardino counties, whether it be senior community centers, hospitals or clinics that are having some type of community fair. You'll start seeing us a lot more frequently as we enter the fall season, with people going to get flu shots. You'll be seeing IEHP at different pop-up locations like that as well. So we are very intentional in making sure, especially that our vulnerable populations, our seniors and non-English speakers are taken care of and feel supported during this renewal period.
Awesome.
If I may add one quick thing. So I think your question, Allison, another question was, what are we doing for the unhoused populations?
Yeah.
So I want to touch really quick on 2 things. So coming off of the partnership, there is a very unique partnership, and we're very happy to be partnering with IHP. So both health plans have taken the approach of being very proactive. But one of the things that we have done is we have partnered right now with Riverside University Health Systems in terms of making sure that we have a co-branded piece that focuses on redetermination. So we can talk about putting it in clinics, talking about putting it in the emergency room at the Riverside University Hospital, and making sure that folks are getting that information out. So it's really not just one individual, it's working as a team to make sure that everybody in the community gets the message. Now, shifting quickly to the unhoused population, we are working with one of our partners, and I'll mention them here, is SWAG. And they work in both Riverside and San Bernardino, but it's really working with partners like them and others that are really focused on the unhoused. We find that a lot of the folks that are unhoused actually do have Medi-Cal. They just don't know who their plan is. So it's really educating those folks that are out in the streets, making these touches, meeting with the sheriff's department that has their homeless outreach street teams that are out and about. We are contracted with providers such as Healthcare in Action that are out doing street outreach, and it's really partnering with them so that they know the messaging, they have the tools at their fingertips. So as they're treating these individuals, they're screening them at the same time to find out, did you get a package? Do you have a steady address? Do you have a phone? Where could we find you? And so we're kind of extending our arm to them, saying, all right, when you are seeing them for these services, how can we make sure that we screen them, number one, that we know when they may be coming up for redetermination, and making sure that we're providing that information for them. So again, working with those partners that are really focused on this population, and those healthcare providers that are doing that street outreach team, as well as the sheriff's department.
Wow, amazing. Rhonda or Andrea or Warren, do you have anything to add about reaching out to the unhoused or homeless at this time?
No.
Okay. Okay, that was really helpful, all of you. Thank you so very much. All right, then Andrea, you're up. What are you finding to be the greatest challenges in the redetermination process in your estimation?
Basically, one of our greatest challenges is ensuring that the member has received that Medi-Cal renewal packet. So part of our marketing this last year has been letting our members know that the packet is going to come in a yellow envelope, which is different than in past years where it has come in a white envelope with a white window, right? But now it's in an 8.5 by 11 size envelope. And so we're really been intentional about having members know that this is how it's coming this year. Some members haven't received the packet because they've moved. And that's where here at IEHP, over the last 12 months, we have been making outbound calls to our members to ensure that we had their current demographic updates, and then sharing that information with the counties. And we're part of our communication over the last year is making sure how important these members know that it is to send the renewal back, because some of the things that we hear most frequently is that, oh, I don't have Medi-Cal, I have IEHP, right? And so, well, both things can be true, but in order to maintain the Medi-Cal eligibility, in order to maintain the IEHP eligibility, is that you have to turn in the Medi-Cal renewal packet. So we have made sure that we are marketing on billboards. Hopefully you've seen our billboards throughout the counties, the texting that I mentioned before, on our websites, our main website, iehp.org, as well as LinkedIn, Facebook, Instagram. We're on Twitter. We are also on TikTok as well. So just making sure that our members have access to the information is one of our greatest challenges that we've seen over the last year. But as now we're in that 4th month of the renewal cycle, we are hearing that members have received the packet and they have already turned it in when we're making those outbound calls, which is phenomenal. We're seeing that more of our members are self-sufficient, and we hope too that it's because of the text messages that we are sending, all of our marketing, as well as the text messages that are going out at the county level as well.
Awesome. That's fantastic. You're overcoming a lot of those things with great success. That's terrific. Rhonda, did you have something to add on that?
Yeah, I would probably say less as a challenge, but more of some enhancements we're working on to help with some system functionality. Is we are, always looking at different ways to improve our system. So one of the examples of something that we're working to get updated is when a customer uses the doc upload feature in Benefits Cal, and they select the document type of Medi-Cal renewal, the customer's reporting detail page automatically is updated to receive status in Cal SAWS, where prior the case was that if they would upload a document and it didn't have a barcode, it wasn't recognizing that information. So what we're doing is being sure that we're making those communications so we can get these enhancements done, so that way we can provide better service to customers all the way around. So that's like example of, we're seeing the system can use some enhancements. We're making sure we communicate those to get those in place as quickly as we can. So that way it provides better service to the customer as well as for our staff that are working the cases. Also, just to kind of piggyback on, a little bit what was recently shared, but, due to COVID and the unwinding, I think many customers have to be getting used to the RE process and getting back into that because it's been on hold for so long. That's, kind of out of sight, out of mind. So I just think, we had to do a lot of training and refreshing of our staff and getting everybody ready and prepared for this, as well as doing the same thing for our customers. So, those are some of the challenges, I will say. You could say it's challenges or ways to find some enhancements on how we're working with staff as well as working with our customers and being sure the systems we have in place are working properly as well.
So instead of challenges, they're opportunities,
Right, right, exactly.
That's fantastic. Great information. Ruthy, did you have anything you'd like to add about challenges and maybe how, identifying those and best ways to overcome those?
And I think for us, sometimes it's phone numbers, very similar to what echoing again what everybody else said, but those phone numbers are magic. It's trying to make sure we know that folks change phone numbers. Sometimes it's really individuals think, well, no, I'm sure they have my information, I'm not going to fill it out. So we have a little bit of procrastination on some of our enrollees, but it's really, again, education, the importance of sharing the phone number. It's really working closely with our providers. Sometimes they have the most up-to-date information on our members. So it's working together to make sure that we're doing data exchange, that we're updating our systems to make sure that we have the latest and greatest information for each one of our enrollees. But for us, we've seen phone numbers. That has been one of the things. And then just talking to members saying, oh no, they should have my information. I'm sure I haven't gotten it. It'll happen. I'll do it mañana, tomorrow.
Yeah, exactly. So let me just jump in before we ask our final question. On that, do you find that you guys sort of answered this about the seniors? We know they're less comfortable on computer and cell phone and all of that, but do you find then, so I think what you're saying, Ruthy, is most of your responses and follow through come about by way of the phone calls as opposed to computer and email and all of that, or would you say it's fairly evenly divided?
Depends on the age group. I think it really depends on who it is. So we again, that's why we have really taken the unique approach of everybody is very different. Every segment of our community is very different. Seniors respond one way. The youngsters today, everything is text, everything is mobile. I mean, they don't want to open an email, they don't want to get a phone call, they just want to text. So it's really targeting the different populations. And understanding. For us on the seniors, it's really been about the providers. The providers have a great success rate in reaching out to members because they are connected. They are getting the care. And so the seniors have a very great trust connection with their providers or with the faith-based organization. So it's really understanding where are these individuals, who do they trust as their messenger to get that trusted message from them. So for us, it's really working on the different levers, understanding who the audience is, and then using the ones that we know are successful with that target population.
Awesome. That makes a lot of sense.
I agree everything with what Ruthy said. I have nothing else to add.
Yeah, I definitely agree. That was, right on target there. So, with our senior population, you know, they seem to be more on guard, but you're right, working with certain, you know, entities, when you talked about community based organizations, they're just build that different rapport. So definitely, I don't have nothing to add to that. So you were right on target, Ruthy.
Awesome. Thanks, you guys. That's great. All righty then. So for our last guided question, and you've all touched on this already, and Ruthy, especially you just did in your response, but how can those assisting and supporting clients in the community be helpful in, I guess, expediting and really streamlining this process? So whether we're talking about community health workers or nonprofit, agency partners, faith-based, that sort of thing. And I'm going to let whoever wants to jump in here first. And Warren, we'd love to get your input as well.
I would say that it's really important that those who are helping and that our members know that it's important to provide the renewal and any verifications by the due date. That is the main way that to avoid disruption in the benefits, is providing things by the date that it was due. If there is a request for more information, provide that by the due date. And then also if there's any changes in that home, to make sure that that member is reporting that information within 10 days. So for example, if they've started a new job or if they've lost a job, if someone is moved in or out of the home, if there was a new baby that was brought into the home, that information is really critical to being reported and being reported on time.
Yes, I would agree with that. You know, providing the information timely, you know, as quick as possible, and especially with phone numbers. Phone numbers change quite often. So we like to, if they have a phone number, even an email address, that's always helpful. So I would state that. And then also I'm going to add to there, just reminding, you know, the persons we serve of some of the self-service options as well. You know, we talked about the different populations for like the younger generation, you know, the self-service options, they're more prone to that versus maybe a senior. So, you know, marketing the self-service options and the reporting, the keeping us up to date, you know, not assuming we already know, just keeping us up to date and timely. That makes a big difference. So I agree.
Awesome. Ruthy or Warren? Ruthy?
I think it was stated right on point. I echo what both Rhonda and Andrea stated. I mean, it's education. It's really making sure it's repetitious. I mean, it's really driving that message to them. Phone numbers are key. Due dates are key. Allow us to help you, your trusted source to get the information and get them enrolled.
Awesome. Warren?
Yeah, I don't have much more to add. Just, you know, make sure they have your current phone number, make sure they have your current address, make sure you turn stuff in on time.
Okay. Well, you know, you've got a whole cadre of partners here, and I know you work with a lot. We're all working together already on this. So all of you presenting already know most of the people on this call, but you know, we're all resources for you. We all want to help in this. So absolutely keep us updated on how we can do that. And I'm not jumping ahead on the questions quite yet, but I see that our friend Jody Wingo, who is CEO of the Community Health Association Inland Southern Region, is on the line with us. And Jody did have a comment earlier about their support of their community health centers are doing a lot of this outreach for the unhoused, especially with their street medicine programs. So Jody, that sort of thing is really important. And that's a great example of partnership, I think. So thanks for adding that into the comments, Jody. All right. Well, those were fantastic. Really, really giving us the landscape here. That's awesome, you guys. Now at this time, I'm going to turn it over to my colleague, Soteria Cobb, who's going to go through some of the questions in the chat that we have not yet gotten to. And there are several outstanding questions and comments here. So Soteria, I will turn that over to you.
Great. Okay, one of the questions, I'm going back towards the beginning of the presentation. Is there transportation for members?
So IEHP does offer transportation services. So if they are a member with us and they need a transportation from their home to the doctor's office, they can call our member services line and they will get transferred to transportation, and that will all be coordinated.
And that is the
Fantastic.
same process today as well for Molina Healthcare.
Wonderful. The other question is from Dr. Pai. Can we get info to give to patients who need this help, please?
What's the best way for someone, say on this call, to say, hey, I want to learn more about this, or I want a physician like Dr. Pai saying, I want to talk to my patients about this. What's their one-stop shop they can go, or multi-stop shop?
So for Molina specifically, there's two ways. One is I'll put my information in the chat. You can reach out to me directly. Happy to work with your staff. Or number two, reaching out to the Molina provider service representative for the provider. So we do an in-service, we'll do a lunch and learn, we'll do different ways of working directly with the provider, also assisting them to access their availability portal so that they can pull their member list from there with the redetermination dates. So there's a lot of information, but we can do a one-on-one directly with the provider office.
Same here. I can provide my information as well. Same process as Molina.
I wanted to go back. I'm sorry. I wanted to look up some information. So there was a question about transportation. And one thing I know many customers that are receiving Medi-Cal are also receiving usually some sort of CalFresh benefits as well. And I wanted to just share through MetroLink, they're able to use their EBT card to get half off, 50% off using MetroLink. I know MetroLink's not always convenient because, may not stop closely, but it's just another area like sharing where they can get some assistance with transportation at a lower cost. So something to share with the group here.
Wonderful. And I want to really quickly just thank you for that, Rhonda. I want to add one more thing about Dr. Pai's question, getting the info. Dr. Pai, this coalition right here, the IECHI, the Community Health Association, we're kind of a convener of all of these folks. And I'd like to just remind you and everyone on here too, you're always welcome to go through us and we can direct you to any of these people. This is kind of our role. We consolidate a lot of this information and these resources. We're kind of like your traffic cop. And we also do partner specifically on a couple of grants with some enrollment partners. So we're all in this to do the same thing. The ultimate goal here is to get as many people enrolled as possible. So it's not, no one's competing with each other. It's just, there are multiple ways for you to reach out. So Dr. Pai, you can always contact any, the speakers who you're talking with here, who are going to put their information in the chat, as well as contact myself or any of us at the IECHI, Dr. Pai, and we can get you connected with an enrollment partner who can expedite this process or tell you what you can share with your patients. We can provide you with information. Okay. All right, Andrea, sorry, go ahead.
No problem, not a problem. What other bottlenecks or roadblocks are folks experiencing in regards to helping with renewals and redetermination?
You guys might have answered this, but if anyone has anything to add that you didn't cover already.
Yeah, we covered this one.
Yeah.
Okay.
Okay.
How does the 85% rate of disenrolled due to procedural compare to the 18 to 20% of disenrolled pre-COVID? Were the bulk of those pre-COVID disenrolled due to procedural reasons as well?
And Warren, I know you answered that in the chat, but maybe you could just state your answer.
Yeah. So I couldn't actually find that information. I was curious about that as well. So I don't know. I do know that CMS, which is the Federal Center for Medicare and Medicaid Services, sent letters to every state back in August, basically saying, hey, these rates are really high. They suggest that maybe, things aren't in the right languages. Maybe the people aren't getting them. Maybe they're not understanding them. There seems to be, like this seems to indicate like there might be some kind of problem here. We really need to work on this. So, I don't know what they were before COVID, but it's a focus right now that everyone's really worried about.
Great. Thank you.
Thank you. Okay, that was basically it. There's a few comments. Can I go ahead and read those?
Yeah, why don't you read Jenny's
Yes.
with St. Mary? Yeah.
I sure will. It says, hi all, Jenny with St. Mary Health Center, a clinic of St. Jude Health Centers at Alonto, Apple Valley, and surrounding high desert areas. As a patient advocate here at the clinic, patients are experiencing extreme difficulty getting a hold of Medi-Cal eligibility workers to get their questions answered. I would be happy to help assist anyone struggling. And Jenny has provided her phone number as well.
Jenny, are you on still?
I am.
Hi. Why
Hi.
don't you, hi there. Tell us a little bit more about that.
So I am getting quite a few patients coming through the doors without an appointment, basically just frustrated with the whole attempt to get a hold of an eligibility worker. Some of them are aware of the redetermination, but just one, language is definitely a barrier, health literacy definitely a barrier to where they receive these documents and they're not understanding what it's saying, what they need to do. So they're trying to get a hold of workers. So as they come through the doors, we do try to schedule them for appointments. If I am available, I will help them right then and there because sometimes getting a hold of them after usually is a bit difficult. So what we're doing is just as they come in, either scheduling appointments with me to assist them. I help either fill out the paperwork or, answer some of the questions, some of the concerns that they may have. If they're not necessarily wanting to complete the paperwork, what is it that's kind of holding them back? Trying to answer their questions and helping them make an informed decision.
Great. Thank you for offering that. And I see Damaris might be reaching out to you. That's good. We work with Damaris, so.
And if I can just chip in on that real quick, not to step on Rhonda's toes, but I know that statewide, the counties have really seen a big staff shortage, a lot of turnover. Even when they do hire, it takes a few months to get people trained up. They're doing the first renewal since 2020, so everything is just kind of backed up right now, unfortunately, and you just got to do your best to try and get through.
Yeah, and we do have the customer service center, and we try to, this is why we also try to encourage, customers as much as possible to use some of the self-service options, but also the call center. And I know there's been times where the wait is longer than they would like, but that just let you know that's something that we're always constantly monitoring, trying to work on, and it's a fine balance. Staffing, it's not a concern of the people we serve. They need to get the service, but we're working on that, and we're also trying to again just continue to enhance other areas that we can to better serve our customers. So
Thank you so very much. Yeah, I see that all of you, thanks for putting all your great contact information in here. Ruthy, Andrea, Rhonda, and Warren, you've all included your contact information, and we will reiterate that when we send that out to everyone. But these are great resources, and we know you guys are doing a lot behind the scenes. It's a high volume of people you're dealing with, and a lot of people that are hard to, track down, and different timelines and things. So it's very much appreciated. Thank you. I don't think we have any more questions, but does anyone want to ask anything? Raise your hand and ask, or yell it out, or whatever you'd like to do. No? All right. Well, I don't see any raised hands. I don't think I'm missing anyone. So I guess in that case, we can give you a few minutes back on your day, but We just want to thank you all so much for your partnership and collaboration in reaching out to these populations and just making our communities so much healthier as a whole. That's our end result, our common mutual objective here. So thank you. Please stay in touch with us on our IECHI website and social media pages so you can find out the dates for our next health education forum, which we'll be determining soon. And we will also be holding our advocacy legislative conference online, likely in January, where we develop a theme each year and have some of our legislators serve on a panel. And it's really the one-on-one with them and a chance to hear what they're thinking, what they're doing in our community. So we'll be announcing that date very soon. We'll be sending you materials, and thank you all so much. Great to see you all. Have a lovely rest of your week and day. We appreciate you all. Bye-bye.